So apparently, one of the biggest barriers to healthcare is age. This surprised me, but I guess it makes sense since most older people live on fixed incomes and can't really pay for health insurance, or at least not to cover all their costs. So this got me thinking, and I did some research. The Aging Administration said in 2013 the elderly population was 14%, or about 1 in every 7 Americans. That's pretty crazy. And by 2060, that number will double. So this problem of not being able to seek healthcare for older adults is definitely a big one, and it's not going away. In my research, I found that there were some main components that elderlies perceived as barriers to care. They were cost, distance, transportation, being too busy, or perceiving their illness as being not that serious. So tonight, I've invited registered nurse and financial healthcare correspondent from New York Presbyterian, Tiffany Clinton Trump, to discuss the financial barriers to healthcare.
Hi, Hamilton.
Hi, thanks for being here.
It's great to be here.
So let's just jump right into it. Health of older Americans has become a critical national policy. Do you think our healthcare system is equipped to face these challenges of quality of life for older adults?
No, and I'll put that back on you. Do you have grandparents?
Yeah?
Have you ever accompanied them to the clinic or to a primary care provider?
Yeah, a couple times.
So, take an example. A little old lady walks into the clinic, complains of stomach pain, and you're thinking, okay, well, she, has, sure, in her life, has racked up a lot of comorbidities. She's rubbing her tummy, and you think, okay, maybe some peritonitis type thing, urinary tract infection. And our main focus would be on diagnosing her disease and treating her disease. What comes after that? Quality of life. Quality of life for the elders, placing an emphasis on that in our society, making sure we're living meaningful lives. They're going into the next stages of psychosocial development, where they can have a true quality of life and be able to afford that quality of life is so important.
So quality of life is a whole other complex and personal concept, it seems.
It's very insightful, Hamilton, and it is. We need greater attention by our healthcare organizations towards the type and cost of care that our elders are currently receiving, and hopefully influence legislators who determine the budget for our national public health.
You think we'd have this figured out by now?
You would think.
So what major issues are we currently seeing in society that affect how care and services older adults are receiving?
So the 4 areas that we have identified is resources that can manage the chronic conditions that our elders currently face, providing them with access to primary care providers who are trained in gerontological care, removing those financial barriers, and changing the healthcare system to one that allocates the capital and necessary resources to provide educational and emotional care for our older adults and families. Prevention is key.
So many financial changes have occurred in the past few years with the passage of the Patient Protection and Affordable Care Act. So those covered under Medicare and Medicaid still have their health insurance, but some positive changes have actually been made. There's more coverage for mammograms and colonoscopies, all these preventative services, and there's more time for well visits for chronic illnesses.
That's very insightful, Hamilton. However, still many medications are paid out of pocket by our elders, regardless of the fact that the Affordable Care Act aims to reduce that cost by 2020. As we can see, that cost is still a barrier for our elders.
Wow. So older adults do have health insurance, so that's not the main issue. I want to point out again that for elderly specifically, barriers to care are transportation troubles, culture, poor health literacy. But I hear what you're saying. Cost is huge. But let me ask you this. Are we providing geriatric-centered care for those who do seek health care?
Older adults are living in long-term care facilities and nursing homes. The average age of an older adult living in a nursing home is 79 years old. As of 2012, about 11.8 million older adults live alone, the majority of those being women. They face the challenge of finding physicians who are educated in the unique health needs of our older adults and those of ethnically diverse groups. Because as you said, cultural differences do play a role in how they seek health care.
So, you're a financial correspondent. So tell me, how do financial issues drive healthcare choices for older adults?
Well, let me tell you, Hamilton, the financial issues faced by many are acquiring treatment and resources to support health. Many pay out of pocket for multiple prescriptions for their chronic conditions, have inadequate reimbursement for their mental health issues, and have lack of screening for sexually transmitted diseases and counseling on those issues.
Let's put this in perspective. Tell our viewers how older Americans compare to elderly around the world.
Gladly. There was a study actually found on a popular database published by the Health Affairs that compared the U.S. performance with other countries, and these countries being Australia, Canada, France, Germany, and New Zealand, for all adults over the age of 65 years old. And what was found was that despite having Medicare coverage, older U.S. adults remain much more likely to face financial barriers, high dependence on the emergency department, and large gaps in care coordination. U.S. elderly are sicker than compared to other nations, reporting a much higher incidence of chronic disease.
Wow. Are older adults financially equipped to handle their medical costs and their day-to-day expenses? Can the current economy handle the costs and the future costs based on the projected growth of the elderly population?
People are living longer and feeling the burden to manage their comorbidities both physically and financially type thing. Major sources of income by older persons were Social Security, accounting for 86% of their income. Income from assets, private pensions, government employee pensions, and earnings for whatever they make. The median income of older persons in 2011 was $27,707 for males and $15,362 for females. So there is a disparity between both males and females. According to the U.S. Census Bureau, a new supplemental poverty measure found the poverty level of older adults was 15.1% compared to the national level of 8.7%. This is due to the out-of-pocket medical expenses, regardless of the fact that Medicare covers 60% of drug costs.
Oh my God, that's something to think about.
It really is, Hamilton. It really
So
is.
while I have you here, as we're coming to an end, I just want to ask you, do you have any closing remarks for the viewers out there and for those in charge of changing the policies for older adults?
Well, I do have a few. As a country, we must commit to embracing the importance of older adults in the quality of care that they are receiving from our healthcare system. They, along with their families, need the educational, financial, and emotional resources to meet the challenges that lie ahead. The fastest growing population in our country are the older adults. It is estimated that by 2030, 70 million Americans will be over the age of 65 and 8.5 million will be over the age of 85. Americans are living longer. They have an increasing need for health care and related services. If we can provide the appropriate financial resources, our healthcare system is evolving and it must keep pace with our older adults.